The sound of a hospital at 3 a.m. is not quiet. It is a hum of electricity, the rhythmic whoosh-click of ventilators, and the squeak of rubber soles on linoleum. To Elena Vance, it sounded nothing like the silence she craved, and nothing like the deafening roar she missed. Elena pushed the heavy industrial floor buffer down the pristine white hallway of St. Jude's Medical Center in Chicago. The machine vibrated through her hands, shaking the bones of her forearms. At 35, Elena moved with a stiffness that shouldn't belong to someone her age. It wasn't arthritis. It was the accumulation of 12 years of jumping out of C-130 transport planes and sleeping in the mud of the Syrian border. She stopped to wipe sweat from her forehead with the back of her sleeve. Her scrubs were a dull, lifeless gray, the color assigned to environmental services and nursing assistants. They were 2 sizes too big, swallowing her athletic frame, designed to make her invisible. "Miss Vance." The voice was sharp, cultured, and dripping with disdain. Elena didn't flinch, but her jaw tightened. She turned slowly, lowering her gaze to the floor. "Yes, Dr. Thorne?" Dr. Julian Thorne stood by the nurse's station, looking like he had just stepped out of a GQ photoshoot. His white coat was starched to perfection. His stethoscope was a master cardiology edition that cost more than Elena's monthly rent, and his hair was slicked back with expensive gel. He was the son of a senator, a Harvard legacy, and the newly appointed chief resident of trauma. He was also, in Elena's professional assessment, a liability. Thorne pointed a manicured finger at a small, brown puddle of coffee near the break room. "I nearly slipped," Thorne said, his voice loud enough to draw the attention of the interns. "We have VIP donors coming through here in the morning. If I break my wrist because you're daydreaming about whatever people like you daydream about, the hospital loses its best surgeon. Clean it. Now." "I was just finishing the main corridor, doctor." "I'll get to it immediately," Elena said, her voice soft. "Don't talk back. Just do." Thorne sneered. He took a sip from his own coffee cup and, maintaining eye contact with her, deliberately tipped it slightly, letting fresh drops splatter onto the floor she had just buffed. "Oops. Better make that a double effort." The interns giggled nervously. Charge Nurse Patty, a stern woman who valued hierarchy over humanity, glared at Elena. "You heard him, Vance. Move." Elena gripped the handle of the buffer until her knuckles turned white. In another life, under a different name, she would have broken Thorne's index finger before he realized she had moved. She was formerly Captain Elena Echo Vance, a pararescue jumper, PJ, surgeon attached to the 24th Special Tactics Squadron. She had performed open-heart massages in the back of burning helicopters. She was a legend in the clandestine community of Tier 1 operators. But here, she was just Elena, the single mother of a 6-year-old girl named Lily who was fighting acute lymphoblastic leukemia. Jude's offered the best oncology trials in the state, and the employee insurance, even for a janitorial assistant, was the only thing keeping Lily alive. "Yes, doctor," Elena whispered. She dragged her equipment toward the spill. Thorne laughed, turning back to his entourage. "See? They need a firm hand. Otherwise, they get lazy. It's genetic, probably." Elena dropped to her knees with a rag. As she scrubbed the floor, staring at the reflection of the fluorescent lights, she repeated her mantra. For Lily. Just survive the shift. For Lily. 2 weeks later, the ER was a war zone. A multi-vehicle pileup on the I-90 had flooded the trauma bay. The air smelled of metallic blood, urine, and fear. Elena was restocking saline bags in Trauma Bay 4 when the paramedics wheeled in a teenager. He was screaming, clutching his chest. "Gunshot wound to the upper right thorax," the paramedic shouted. "BP is crashing. 80/50. Tachycardic at 130. Thorne swept into the room, his ego expanding to fill the space. "I've got this. Get him on the monitor. Nurse, prep a chest tube." Elena lingered by the supply cart, watching. She saw what Thorne missed. The boy wasn't just struggling to breathe. His neck veins were distended like ropes, but his trachea was midline. The monitor showed the heart rate climbing, but the pulse pressure was narrowing. Thorne was holding a scalpel, aiming for the fifth intercostal space to insert a tube for a collapsed lung. "He's got a hemothorax," Thorne announced for the benefit of the watching medical students. "We drain the blood, he stabilizes." No, Elena thought, her heart hammering. Look at the monitor. Look at the electrical alternans. The boy's EKG tracing was oscillating big waves, then small waves. "Dr. Thorne," Elena said. The room went silent. A janitor/assistant never spoke during a code. Thorne paused, scalpel hovering inches from the boy's skin. He looked at her with incredulity. "Excuse me?" "The EKG," Elena said, her voice steady but quiet. "It's swinging. Electrical alternans. And his heart sounds are muffled. It's not just a collapsed lung. It's cardiac tamponade. If you put a chest tube in, you won't fix the pressure on the heart. He needs a pericardiocentesis. You need to drain the sac around the heart." Thorne's face turned a violent shade of red. "Are you diagnosing my patient, janitor? You read a WebMD article and think you're a doctor. Sir, look at the neck veins. Beck's triad." Elena pressed, stepping forward involuntarily. "If you don't drain the pericardium, he will arrest in less than 2 minutes. Get her out," Thorne roared. "Security, remove this woman. She is interfering with a life-saving procedure." Nurse Patty grabbed Elena's arm, digging her nails in. "You have lost your mind, Vance." Now, as Elena was dragged backward, the monitor began to scream. A flat, singular tone. "Beep. He's coding," a nurse shouted. "No pulse." Thorne froze. He stared at the monitor, panic flickering behind his arrogant eyes. He had never seen a textbook failure like this in real time. The chest tube he was about to insert would be useless. Suddenly, Dr. Samuel Chun, the weary but brilliant attending physician, burst through the curtain. He took in the scene instantly. The distended veins, the flat line, Thorne's frozen hand. "Needle," Chun barked. He didn't wait. He grabbed a 16-gauge spinal needle from the crash cart. He bypassed Thorne, located the xiphoid process at the base of the sternum, and plunged the needle in at a 45-degree angle, aiming for the left shoulder. He drew back the plunger. The syringe filled with dark, non-clotting blood. On the monitor, a rhythm returned. Beep, beep, beep. The boy gasped, color returning to his gray face. Dr. Chun exhaled, wiping sweat from his brow. He looked at Thorne. "You were treating a lung issue when the heart was being strangled, Julian. You almost killed him." Thorne swallowed hard, his ego bruised but his defense mechanisms activating instantly. I was about to check for that. The noise, that woman distracted me. She broke the sterile field with her shouting." Dr. Chun turned to look at the door where Elena was still being held by security. He looked at the janitor, really looked at her, noting the calm intensity in her eyes, the 1,000-yard stare he had seen on soldiers during his residency at the VA. "Let her go, Patty," Chun said quietly. "But doctor, I said let her go, and get this boy to the OR." Later, in the break room, Thorne cornered Elena. He didn't thank her. He loomed over her while she was eating a cold sandwich. "You think you're smart," Thorne hissed, his voice low and venomous. "You got lucky with a guess. But you humiliated me in my ER." "I was trying to save the patient, doctor," Elena said, not looking up. "You are on thin ice, Vance. One more mistake. One spilled coffee, one unemptied trash can, one word out of turn, and I will personally see to it that you are fired. And I know about your daughter." Elena froze. She looked up slowly. "That's right," Thorne smirked. "I checked your file. Little Lily. Leukemia, isn't it? Expensive treatment. It would be a tragedy if her mother lost her health insurance because she couldn't learn her place." A dark, cold rage bloomed in Elena's chest. It was the kind of rage that allowed a person to pull a trigger without blinking. But she saw Lily's face in her mind, pale, bald, smiling over a coloring book. "Understood, doctor," Elena said, her voice dead. "Good. Now, my shoes have blood on them. Clean them." Elena stared at his expensive Italian loafers. Slowly, She reached for a rag. 3 weeks later, Chicago was hit by the worst blizzard in a decade. The roads were closed. The city was paralyzed. St. Jude's was running on generator power and skeleton staff. At 0200 hours, the red phone at the charge desk rang. It wasn't the paramedic line. It was the direct line to the Department of Defense liaison. Dr. Chun answered. His face went pale. He hung up and shouted, "Code Omega! We have an inbound extraction via heavy lift chopper. Roof access. ETA 3 minutes. What is Code Omega?" Thorne asked, looking annoyed. "I'm on break." "It means military classified," Chun snapped. "Massive trauma. High-value asset. Get the trauma team to the elevator. Now." The building shook. It wasn't the wind. It was the thumping, rhythmic beat of rotors, heavy military rotors. Elena was mopping the hallway near the elevators. She stopped. Her body reacted before her brain did. That wasn't a medevac chopper. That was an MH-47 Chinook. The engine pitch was unmistakable. The 160th Special Operations Aviation Regiment. She dropped her mop. "Vance!" Nurse Patty yelled. "Clean up that water. We have VIPs coming." Elena ignored her. She walked toward the trauma bay, her stride lengthening, her shoulders squaring. The shuffle of the janitor was gone. The walk of the operator returned. The elevator doors pinged open. For men in full tactical gear, multicam uniforms, night vision goggles flipped up, rifles slung across chests, burst out. They were carrying a stretcher. On the stretcher lay a man who looked like he had been chewed up by a meat grinder. His leg was a ruin of torn flesh and exposed bone. His abdomen was distended. He was gray, unconscious, and soaked in blood. "Clear the way!" one of the soldiers screamed. He was a giant of a man, bearded, with a patch that said, "Tex. We need a surgeon now. He's bleeding out." Thorne stepped forward, adjusting his glasses. "I am the chief trauma resident. Bring him to Bay 1. Security. Get these weapons out of here." "Screw your security," Tex growled. "This is Colonel Marcus Graves. He doesn't die. You hear me? He doesn't die." They slammed the gurney onto the trauma bed. Thorne looked at the injuries and paled. It was a mess of high-velocity ballistic damage and shrapnel. "Nurse, start 2 large-bore IVs," Thorne ordered, his voice trembling slightly. "Get a CT scan of the abdomen." "No time for CT," Tex yelled. "He's got an abdominal bleed. He took shrapnel from an RPG. I need to see what I'm dealing with." Thorne shouted back, his arrogance masking his panic. "Push 2 liters of normal saline, stat. We need to get his pressure up." Elena was standing in the doorway. She saw the blood soaking through the colonel's bandages. She saw the pallor. Lethal triad, she thought. Hypothermia, acidosis, coagulopathy. "No saline," Elena shouted. The room froze. Thorne spun around. "You! I told you." Elena stepped into the room. She didn't look at Thorne. She looked at the soldier, Tex. "Sergeant," she said, her voice possessing a distinct, clipped command tone that cut through the chaos like a knife. "If they push saline, they will dilute his clotting factors. He's already coagulopathic. You pump him full of water, you kill him. He needs whole blood, and he needs a Reboa catheter to stop the pelvic bleeding, or he's dead in 60 seconds. Tex blinked, looking at the woman in the oversized gray scrubs. He recognized the tone. It was the tone of an officer in the field. "Who the hell are you?" Tex asked. "Security," Thorne screamed. "Get her out. She's a janitor. She's fired. She's crazy." 2 security guards rushed in, grabbing Elena. "He needs an aortic occlusion," Elena yelled, fighting the guards. "Thorne, look at his pressure. 60/40. He's exsanguinating. If you send him to CT, he dies in the elevator. Get her out." Thorne was hysterical now. "Push the saline." The nurse reached for the saline bag. The monitor alarms turned into a solid whine. The colonel's heart rate plummeted. 40. 30. He's coding. Thorne froze. He stared at the body, paralyzed. The injuries were too catastrophic. He didn't know where to start. He was a textbook doctor, and this was a battlefield butcher shop. Elena broke the grip of one guard with a sharp elbow to the solar plexus. A move so fast and violent the guard collapsed wheezing. She spun and swept the leg of the second guard. "Let her work," Tex roared. The giant soldier raised his rifle, not pointing it, but using the barrel to block Thorne from the table. "You froze." Document stepped back. "This is insane," Thorne shrieked. "I'll have you all court-martialed." Elena sprinted to the table. She didn't ask for permission. She grabbed a scalpel and a specialized kit from the crash cart that she knew was there because she had stocked it herself. "I need a femoral access kit," Elena commanded. She looked at Nurse Sarah, the young intern. "Sarah, give me the kit. Now." Sarah, wide-eyed, handed it over. "You are not a doctor," Thorne spat. "I am Major Elena Vance, United States Air Force Pararescue Surgical Team," she said, her voice cold steel. "And right now, this is my patient." She didn't wait for the shock to register. She cut into the colonel's groin. Blood sprayed, warm and dark. She ignored it. She threaded a guide wire up the femoral artery, moving by feel, her eyes closed for a split second to visualize the anatomy. She was back in the sandbox. The smell of bleach vanished, replaced by burning diesel. "Guide wire in. Catheter advancing," she narrated calmly. "Zone 1. Descending aorta." She inflated the balloon at the tip of the catheter inside the colonel's main artery. Instantly, the blood flow to the lower body stopped. The blood was diverted to the heart and brain. "Balloon up," Elena said. On the monitor, the flat line stuttered. Beep. Then again. Beep. The blood pressure shot up. 90/60. "We have a pulse," Sarah cried. Elena didn't stop. "He's got massive internal bleeding. We have maybe 20 minutes before the balloon causes ischemic damage. We need to crack him open. Now." She looked at Dr. Chen, who had just run in. "Dr. Chen, I've occluded the aorta. He's stable enough for transport to the OR, but you need to move." Dr. Chen stared at the catheter protruding from the colonel's leg, a procedure that only a handful of trauma surgeons in the country could do blind. "Get him 2 or 1, Chen ordered, his voice filled with awe. "Vance, you're scrubbing in." "No." Thorne stepped forward, his face purple. "She is a janitor. She assaulted security. I am calling the police." Tex, the massive soldier, stepped in front of Thorne. He leaned down, his face inches from the doctor's. "You call the police," Tex whispered, "and I will feed you that stethoscope. The lady saved the colonel. You tried to drown him in salt water. Sit down and shut up." The surgery took 6 hours. Elena didn't scrub in. Hospital protocol strictly forbade it, and once the immediate crisis was over, the bureaucracy slammed back into place. Dr. Chen performed the surgery, guided by the stabilization Elena had achieved. When Elena walked out of the trauma bay, covered in the colonel's blood, the adrenaline crashed. The hospital administrator, a severe woman named Ms. Goyle, was waiting with 2 police officers and a smug-looking Dr. Thorne. "That's her," Thorne said, pointing. "She assaulted my staff, practiced medicine without a license, and endangered a VIP patient." "Elena Vance," the officer said, stepping forward. "We have to ask you to come with us." "She is fired, effective immediately," Ms. Goyle said, "and we will be suing for damages. You'll never work in this state again." Elena felt the world tilting. Lily, the insurance. It was gone. "I saved his life," Elena whispered. "You got lucky," Thorne sneered. "You're a liability. Get her out of my sight." They escorted her out the back entrance. They didn't even let her change out of her bloody scrubs. She walked into the blizzard, shivering, the cold biting into her skin. She took the bus home, people staring at the blood on her clothes, moving away from her. She got home to her small, drafty apartment. Lily was asleep, a feeding tube taped to her cheek. Elena sank to the floor and wept. She had won the battle, but she had lost the war. She had no job, no insurance, and likely a lawsuit coming that would bankrupt her. 3 days later, The ICU was quiet. Colonel Marcus Breaker Graves opened his eyes. Pain radiated from every nerve ending, but he was alive. He blinked, focusing on the figure standing by the window. It was Dr. Thorne, holding a clipboard, looking solemn and heroic. "Colonel," Thorne said, putting on his best bedside manner. "Welcome back. It was touch and go, but we managed to pull you through. I'm Dr. Thorne, the chief of trauma. I oversaw your surgery." Graves tried to speak. His throat was like sandpaper. "Water." Thorne held a cup to his lips. "My men," Graves rasped. "They are in the waiting room. We had to keep them out for sterility." Thorne lied. He had actually banned them from the floor. Graves frowned. He had fragmented memories of the ER. The pain, the cold, and a voice. A woman's voice. Commanding. Calm. "No, Saline. Where is she?" Graves asked. "Who?" "The woman. The one who put the balloon in." Graves knew combat medicine. He knew what a Reboa was. He remembered the feeling of the pressure returning to his brain just as the lights were going out. Thorne's smile faltered. "Ah, you must be confused, Colonel. Hallucinations are common with blood loss. I managed your resuscitation. There was a disturbance with a member of the cleaning staff who had a mental break, but we handled it." "A cleaning staff?" Graves narrowed his eyes. "A janitor put a Reboa in my femoral artery?" "No, no." Thorne laughed nervously. "I did the procedure. She just yelled a lot. We fired her." Graves stared at Thorne. He had been interrogating terrorists and liars for 20 years. He knew the smell of bullshit. It smelled like expensive cologne and fear. "Get me my team," Graves said. His voice was weak, but the order was absolute. "Colonel, you need rest. Get them now." Thorne scrambled out of the room. Minutes later, Tex and the squad walked in. They looked furious. "Boss," Tex said, gripping Graves' hand. "You look like hell." "Report," Graves said. "Who operated on me?" "The Asian Doc Chin." "He's good," Tex said. "But the one who saved you? The one who did the plug? That was the janitor. Thorne tried to saline you to death. The girl, Elena, she fought the guards and took over. Boss, she moved like us." "Where is she?" Tex looked at the floor. "Thorne had her arrested and fired. They stripped her insurance. We heard she has a sick kid. We've been trying to find her address, but the file is sealed." Graves tried to sit up, groaning as his stitches pulled. A cold fury, colder than the blizzard outside, settled in his gut. "Hand me the sat phone," Graves ordered. "Boss, you're not supposed to make calls," Tex warned. "I'm calling the Pentagon, and then I'm calling the Admiral." Graves' eyes were hard as flint. "Nobody leaves my people behind, especially not the one who saved my life." A week later, Elena sat in her apartment, staring at an eviction notice. She hadn't left the house. She was rationing Lily's medication. There was a knock at the door. Elena didn't move. "Go away," she called out. "I don't have the rent yet." "Major Vance?" a deep voice called. "This is Sergeant Miller, U.S. Army." Elena froze. She opened the door. Tex stood there, filling the doorway. Behind him was a black SUV with diplomatic plates. "Ma'am," Tex saluted. A sharp, crisp salute. Elena's hand twitched. "I'm not a major anymore, Sergeant." "The colonel disagrees," Tex grinned. "Grab your gear, ma'am. We're going to the hospital." "I'm banned. They'll arrest me." "Let 'em try," Tex said. "We have orders to escort you to a board of inquiry hearing occurring right now at St. Jude's. The colonel wants you there." "I can't leave Lily." Tex stepped aside. A frantic-looking woman in a Navy nurse uniform stepped forward. "Ma'am, I'm Lieutenant Evans. I'm here to stay with your daughter. I have a full mobile pediatric kit in the car. She'll be safe." Elena looked at Texas. She saw the respect in his eyes. She nodded. She went to her closet and pulled out the one thing she had kept hidden. Her old dress blues jacket, stripped of insignia, but perfectly pressed. She put it on over a white t-shirt and jeans. "Let's go." The boardroom of St. Jude's was packed. The board of directors, Ms. Goyle, and Dr. Thorne sat at a long mahogany table. They were discussing the lawsuit against Elena Vance. "We need to make an example of her," Thorne was saying, looking confident. "We can't have unskilled labor thinking they can play doctor." The double doors slammed open. Tex walked in first, rifle slung low. The board members gasped. Then Colonel Graves rolled in. He was in a wheelchair, pushed by another operator. He was pale, but wearing his full dress uniform, his chest heavy with medals, silver star, purple hearts, bronze stars. And beside him walked Elena. She wore jeans, but she held her head high, walking with the predatory grace of a panther. "What is the meaning of this?" Ms. Goyle stood up. "Colonel, you should be in bed. And she is trespassing." "Sit down," Graves said. He didn't shout. He didn't have to. The voice carried the weight of absolute authority. Ms. Goyle sat. Graves wheeled himself to the head of the table. He looked at Thorne. "Dr. Thorne," Graves said, "you claim you performed the Reboa procedure on me." Yes, I supervised it," Thorne stammered, sweating. Graves pulled a remote from his pocket and clicked it. A large screen on the wall flickered to life. It was security footage from the trauma bay. The room watched in silence. They saw Thorne panic. They saw him order the saline. They saw Elena break the hold of the guards. They heard her diagnosis. They saw the speed and precision of her hands as she inserted the catheter while Thorne cowered in the corner. The video ended. Graves turned to the screen again. "Admiral, did you get that?" The screen changed. A video call feed appeared. A man with 4 stars on his shoulder sat behind a desk at the Pentagon. "Admiral Holloway." "I saw it, Colonel," the Admiral boomed. "Dr. Thorne, your medical license is hereby suspended pending a federal investigation for falsifying records and gross negligence involving a Tier 1 military asset." Thorne's face went white. You can't." "I just did," the Admiral said. "And Ms. Goyle?" St. Jude's receives $40 million a year in DoD grants. That funding is frozen until Major Vance is reinstated with back pay and a formal apology. Ms. Goyle looked like she was going to faint. She turned to Thorne. "You told me she was crazy. You told me you saved him." "He lied," Graves said simply. He turned to Elena. The room fell silent. Thorne was slumped in his chair, a ruined man. The arrogance was gone, replaced by the hollowness of exposure. Graves looked up at Elena. He struggled to stand. Tex moved to help him, but Graves waved him off. With trembling legs, the colonel stood up. He faced the janitor. "Major Elena Vance," Graves said. "The Pentagon thought you were dead. You disappeared after the crash in Syria." "I had to protect my family, Colonel," Elena said softly. "You saved my life," Graves said. "You risked your freedom, your job, and your safety to save a man you didn't know. In a room full of people who treated you like dirt." Graves slowly raised his hand. He snapped a salute. It wasn't a casual gesture. It was a salute of profound gratitude. Tex and the other soldiers in the room snapped to attention and saluted. Dr. Chun, standing in the back, slowly stood up and placed his hand over his heart. Elena stood there, the tears finally spilling over. She wasn't the ghost anymore. She wasn't the janitor. She was Echo. She straightened her back, snapped her heels together, and returned the salute. "Hoo-ah, Colonel." Thorne was escorted out of the building by security, the same guards he had ordered to attack Elena. They weren't gentle. Ms. Goyle was fired by the board that same afternoon. 2 hours later, Elena sat in the VIP suite with Graves. "So," Graves said, sipping juice, "the Admiral has an offer. We need a chief medical officer for the new Joint Special Operations Training Facility here in Illinois. No deployments. 9 to 5. Pay is significantly better than cleaning floors." "Does it come with benefits?" Elena asked. "Full military coverage. For you and Lily, including experimental treatments at Walter Reed." Elena smiled. It was the first time in years she had smiled with her whole face. "I have one condition," Elena said. "Name it." Dr. Chun comes with me. He's the only one in this building who remembered what the oath means. Graves grinned. Done. Elena walked out of the hospital that evening. She didn't take the bus. A government sedan was waiting for her. As she passed the front desk, Nurse Patty and the interns watched her go, their mouths open. Elena didn't look back. She didn't need their validation. She had her mission, she had her dignity, and most importantly, she had her daughter's future secure. She looked up at the sky. The storm had passed.